The negative impacts from the use of alcohol and other drugs is a growing issue for health systems around the world, not only affecting individuals, but families and communities as well. The House Health, Aged Care and Sport Committee has launched a new inquiry into the problem and what can be done about it in Australia. We caught up with Chair of the committee, Dr. Mike Freelander, and Deputy Chair, Mr. Julian Leeser, to find out more.
We've been tasked by the Health Minister into conducting an inquiry into alcohol and other drugs and their effect on different portfolios around the country. As a paediatrician, we see drug and alcohol effects in things like fetal alcohol syndrome, which is having a devastating effect in some communities. Even now in the 21st century, we're seeing how drug and alcohol problems are affecting our adolescents and our young people around Australia. And how we can deal with that is very important. It's causing a lot of difficulty in our health system, and we need to deal with it better.
In relation to families and communities, obviously when people are spending money feeding an addiction, they're not spending money feeding their family. And that's often the downstream effect of this. And we know there are other social problems that are provoked by addiction, such as obviously things like theft, things like domestic violence and the like. So there are broader issues around this inquiry.
Through the inquiry, the committee hopes to learn better ways to fight this preventable illness.
Well, alcohol abuse is having a huge effect across our health system, our social security system, and also in areas like family violence and effect on women and children. And this is something that we've struggled to address for decades. And we really do need to look at ways that we can reduce alcohol abuse, not just because of the health effects, but because of the social effects of alcohol abuse, which have reached epidemic proportions.
With addiction rates climbing all over the world, the inquiry hopes to learn from overseas examples.
We know addiction rates to addictive substances like drugs and alcohol are going up all around the Western world. And we're talking about not just illegal drugs but legal drugs as well, particularly in North America and in parts of Europe as well. And we want to learn as well where those societies have gone wrong, where those countries have gone wrong, and what we can do to prevent those rates of addiction that we've seen there from coming to Australia as well.
The committee hopes to hear from as many individuals and experts as possible to help shape evidence-based policy ideas.
In particular, we need evidence-based policy, and the evidence that we will be gathering from experts and from others with lived experience, we will be presenting to the Health Minister to make sure that our policies as we go forward are based on evidence and will do real good in this very troubled space.
It's really important that we hear from people on the front line, people who've got expertise from their research, but people who can give us lived experience as well. That will make the inquiry so much richer.
Thanks for watching. To make a submission or find out more about the inquiry, visit aph.gov.au/alcohol and other drugs.